Today's guest is a certified doctor of death, Dr. Feng Li. He's a forensic pathologist and the current chief medical examiner for Nashville, Tennessee, and the surrounding counties. Dr. Li also holds a PhD and a law degree and has been a practicing attorney in the state. He's been with the medical examiner's office for over 25 years and has been involved in over 6,000 autopsies. He's also been a part of major murder investigations in the state. Today, we discuss how to perform an autopsy, performing autopsies after a body has been buried for 30 years, whether or not Jefferey Epstein killed himself or was murdered, and performing autopsies on aliens. Today's guest, Dr. Feng Li. Like the thin-bladed saw with the handles. Mm-hmm. And so she starts sawing back and forth, but she was...
Oh, not electric?
No, so we had... we had the blade saw. And so she's moving it back and forth to saw through the tibia and the fibia.
Oh, my God.
And she couldn't get the angle enough because she was short. And so she was about to get a step stool, but I was like, I can finish that for you. And she's like, sure, here you go. And so I'm 20 years old and I just get to saw. And then they take it and they put it in a trash bag. But me being 20, I thought that was insane.
You mean the leg put in trash bag?
Yeah, they put it, they had a black trash bag and they sawed it off on the bed in the OR and they put it in the trash bag and tied it up.
Usually, standard procedure is that leg amputated should be sent to pathology department.
They might have. I don't know what they did with it afterwards. You'll probably hate this. So we finished with the operation. I think they did the flap over the knee and they closed it.
All right.
And then I asked the nurse to grab my phone out of my scrubs. And she grabs my phone. And then I go to the bag. And I was about to open it. She's like, what are you doing? I was like, oh, I was going to get a picture with the foot. She's like, you can't do that.
You cannot do that. Because, the privacy. And, I told them, when they visit us, you cannot post that Instagram, Facebook, social media,
Yeah, because that picture would have been terrifying.
Right, exactly.
With me with a severed foot.
Yeah.
Good. All right. Dr. Li, thank you for being here.
Thank you for inviting me here.
So you are the chief medical examiner for Davidson County, Nashville?
Yes, I was appointed by the mayor in 2016 as the chief medical examiner for Metropolitan Nashville and Davidson County.
So here, pull this in a little bit. Here, a little bit closer. There we go. We'll cut that out. So what does a medical examiner do? Because I've heard of a coroner, but...
Right. Medical examiner is in charge for medical legal death investigation in your jurisdiction. Originally or initially, the old system is called coroner system. They were inherited from Britain. When people moved from Britain, they brought with them the system of medical legal death investigation. Basically, coroner is associated with the crown. Mm. In Britain, that the crown is royal and they own everything. When some people died, they will dispatch the coroner to do the investigation to make sure the person died. Mm. If they had any property, they will make a proper distribution. That's their job.
Because I remember, because I grew up in Georgia, and there was a coroner in our little town, but he also ran the funeral home.
Right.
And so I was like, is this a little conflict of interest?
Right. So there are two systems in the United States of America in medical legal death investigation. One old system is called coroner, and the newer one is called a medical examiner. Was established in the late 19th century in Northeast, in Maryland, Massachusetts, New York. And then the two systems still coexist. Mm. And approximately 50% of the population is now served by coroner system, and another 50% is served by medical examiner system.
And so coroners, they don't do autopsies or investigations anywhere. That's passed to medical examiners?
Depends on the local law. And some forensic pathologists, they campaign for the election. If they are elected as coroner, then they can do autopsies. So most coroners, they will compete or campaign for the official job. And they will usually hire forensic pathologists to do the autopsy for them. And in terms of the different qualifications, medical examiner sometimes interchangeable with forensic pathologists, but forensic pathologists are more specialized. They went to medical school to be accepted as a pathology resident, and then fellowship training in forensic pathology, and then become a forensic pathologist after they usually pass the board examination.
And so you yourself, whenever I was looking into you, you have a very impressive history. So you have an MD, a PhD, and a JD.
Yes. So I am board certified by American Board of Pathology in anatomic, clinical, and forensic. And also, after I became an assistant medical examiner here in Nashville, I went to law school to pursue my legal degree.
Oh, wow.
And
how old were you at this point?
That was like 40-something.
So at 40, you're like, a doctor's not good enough. I need to be a lawyer too.
Right. So all my classmates at law school were about my son's age. They were fresh graduated from college. Some are higher, older. But among the 160 or so students, only 2 physicians were at a class. So another classmate of mine also is a physician. He's an ER doctor. I'm a forensic pathologist. So these are the 2 doctors in the law school. So go back to the qualification of the medical examiner versus coroner. The medical examiner usually is a physician, licensed physician. And a forensic pathologist is also a physician. And qualifications, medical school, residency training, fellowship training, and then to go into this specific field. The coroner, on the other hand, is different. Most places, they don't require any medical background. They can be anybody older than 18 years of age, no criminal history, and not necessarily medical fields, and they campaign for the position.
That's an interesting position to campaign for.
Right, just like any a city mayor, councilman, and so on.
So being a coroner and a medical examiner, it's really an intersection of the healthcare and law.
Yes. So forensic pathology, forensic is generally regarded as legal issue. So in the forensic area, there are multiple fields. Generally speaking, there's an forensic anthropologist. They examine the bones, the skeletal remains, to see if there is any injury to the bones. And then forensic odontologists. They are dentists. They are specialized in comparing the antemodern versus postmodern dental marks to determine the positive identification. There are other forensic fields as biology, nursing, and jurisprudence. They are legal lawyer and required in the field. Also forensic psychiatrists. So among the most forensic fields, I think 2 fields will require medical degree. One is forensic pathologist. One is forensic psychiatrist. And forensic pathologist is in charge of, as I said, medical legal death investigation. So in the state, usually they have a list called reportable cases. And the the forensic pathologist or medical examiner's office has its jurisdiction. Basically, you have the responsibility to investigate all the trauma, all the violent death, all the deaths in custody, all the death in job, and the children, and the other cases without the attending physician's treatment.
So whenever you were initially going through medical school, did you see yourself in this field of medical examination and working with death and death investigations?
Not really. When I graduated from a medical school in China. I came here to the United States of America. First stop is in Louisville, Kentucky.
That's a lot different than China.
Exactly. It's a culture shock at the time.
What was the biggest thing that when you left China and you landed in Kentucky?
Right.
How was that?
So there are so many different stuff. For example, the highways, the cars. So, when you drive in the evening, you can see the taillights in front of you, the headlights on the other sides. So many cars. It was a shock. And other things like so many choices in the grocery store. Different brands, different stuff. You can buy whatever you want.
So in China, is it different? Is it?
At that time, almost 40 years ago, it was very, very different. But nowadays, the difference is very, very little. And China is so developed, and they have basically everything.
Because they
here
moved
in the country
closer to a hybrid economy as the years went on.
It's it's their own characteristic, their own style, but the difference is so small you cannot tell the difference actually.
So I don't want to go off rails too much, but growing up in China, so this was in the 50s or 60s or 70s?
60s and 70s.
So what was that? What was China like back then growing up? Because it's much different now.
Oh, yeah. At that time, it was a poor country and a third world country. It's still in development stage, and people are basically poor. They didn't have much in their possession. And my main reason to come to the United States is to get a higher education, not graduate education. I was accepted as a PhD student at the University of Louisville in Louisville, Kentucky in 1988. So I came here to this country in 1988. After that, I got my PhD degree. I moved to Philadelphia and had my postdoctoral fellowship training and then residency training in pathology and fellowship training in forensic pathologist, also in Philadelphia. After I finished my forensic pathology fellowship, there was a job opening in Nashville. So, I came here. I love Nashville. I moved to Nashville in July 2000. And I have never moved after I moved to here in Nashville.
So were your parents growing up in China, were they in the medical field or were you the first one?
Actually, my mom is a general surgeon in China.
Oh.
And my father was also in the medical fields, but in an administrative duty.
Wow. So, because both my parents were paramedics and paramedic firefighters. So growing up, they would always come home and tell me stories of picking people up off the streets. And was that like your parents would come home and share medical details with you as a kid?
Yeah. My mom, worked in a hospital as a surgeon. I mean, a lot of times she would be in a second shift, a third shift, and we often stay in a hospital, physician lounge or, bed overnight with mom. So I grew up in the hospital, was very often on call in the hospital, stay overnight in the hospital. So we, as a kid, were basically very often
So growing up, did you want to be a doctor because they were doctors, or were you interested in the medical field?
Actually, I was not interested in medical fields because I don't want to say I hated seeing patients, and then it happens that
You work with patients you don't have to talk to now.
exactly, that's like the thing, and I didn't go into the medical school, but eventually my parents said, it's a good idea to go to the medical school, so I went as they wished. So I graduated from medical school and had some graduate studies in research as a teacher. And then I saw a desire to go to United States to get more degrees. And that was the reason I came to this country.
And so what was your first introduction with working with people post-mortem where that piqued your interest?
Right. So that was when I was in the residency training. So the residency training in Philadelphia, the residency program required every resident in the program rotated through the medical examiner's office in Philadelphia. So I went to the rotation, met all the attendings, death investigators, technicians, and I saw that this is what I am interested in. That's where my passion was.
And what was it about? Is it just the problem solving, the puzzle?
So there are several reasons. First of all, the job impact they did impact the community, impact the families as a general. And the second, there's a lot of excitement in involved because when you saw the news, and sometimes the next day you'll see the victims, and although it's not like exciting for the family, but a lot of times you see that, and you will be involved in dealing with this postmortem.
That's your time to go to work.
Yeah.
Whenever they're
sometimes, but as a general, the homicide, the crime actually is not the major job in our field. In terms of the statistics, the majority cases will be involved in or accidental death, accident, died as a result of accident, motor vehicle collision, drug overdoses, and other accidental death.
In Nashville, where you're at right now, what do you think the most common annual accidental deaths are? Is it from vehicles or drugs?
Right, a combination of both. Motor vehicle is one major component of accidents. Drug overdoses, especially for the young people, very productive aged persons, they died as a tragedy as a result of drug overdoses. Fortunately, the trend in the drug abuse is decreasing thanks to the combination of measures by the government, by the family, by the education. And I think this is in the right direction. The death as a result of drug overdose is decreasing.
So when you were a resident in Philadelphia, did you assist in, say, autopsies or death investigations and then eventually lead one yourself?
Yes.
So do you remember your first one leading?
Actually, not necessarily, because there are so many cases. You mixed them up and you don't remember a lot of details. But after my first rotation, 1 month, I was so excited and interested, so I demanded a second rotation. So I went a second time and then talked to the chief of medical examiner at the time. And I said, I'm interested in applying for the fellowship training. And actually, it was very competitive, and I was fortunate enough to be accepted as a forensic pathology fellow at the time. And after I graduated, I moved here in Nashville.
And so is that field, once you get certified, so you now, when you move to Nashville, you're leading, or I don't know if leading is the right term. Do you do autopsies by yourself, or do you have an assistant usually?
Right. We, as a pathologist or forensic pathologist, we do autopsies, myself included, and we have assistants, as you know, usually they call the technicians. They will help us doing the autopsies, and investigators will go to the scene if necessary to investigate the death scene. And
now, do you do that as a pathologist? Do you ever go to the scene?
It's only in high-profile cases, and sometimes, you know, if they ask a forensic pathologist to be at the scene, we will go.
Without, I don't know exactly what you can disclose, but have you been to any of those high-profile cases where you had to be there?
Yes. The most famous one is Steve McNair, and I went to the scene.
What happened with Stephen?
So I don't want to go to this detail, but that was the scene I went to.
Well, I guess whatever's public information. I'm not familiar with the case. Was he a murder or?
Yeah, he was murdered, and it was like a crime scene.
And so whenever you come to say that crime scene or any crime scene, when you first walk in, what does your mind start doing? Are you going through a checklist? Are you looking at things?
Right. So the detectives, they will already secure the crime scene. And when we are there, we will go inside to see the general scene. What type of scene, what nature of the scene, how many people died, and what is the scene about? It's a gunshot wound, it's a stab wound, or other just natural death, or so on. And then examine the victim or victims to see what they have.
So as a forensic pathologist, what's the benefit of being there on scene and doing that instead of them bringing the body to you?
The scene investigation is critical and crucial to our investigation. And we have many death investigators, and they will routinely go to the scene.
And is that more in homicides that they would actually go to the scene?
No,
or suspected?
All kinds of scenes. First of all, the death investigators are the ones who receive the report of death. And then they decide whether we will go to the scene, what type of death, whether it's natural death, whether it's motor vehicle collision, whether it's homicide or suicide. And they responded to the scene to do the first investigation. And the crucial part is this. If I'll give you an example. If a baby died and found in between the two beds or, wedged somewhere, and if we don't respond to the scene, we don't know the story, sometimes it's hard for us to determine the cause of death and manner of death. And because the autopsy itself will not rule in or rule out what happened.
Because that's pretty cut and dry on the clinical side if it's just suffocation, but you don't know the story of maybe how it happened.
No, even not in the clinical side, because autopsy itself will not just reveal the changes. And this is crucial, a piece of evidence that the baby or the infant or child was wedged between somewhere in the mattress, the wall, and two mattresses, and so on, or underneath an adult when they co-sleep. So this is a crucial piece of information we needed to know. And that's why we have investigators go to the scene, and we have on call 24/7. And whenever the death reported, if necessary, our investigators will respond to the scene. Same thing, happens when I went to the scene and you see the bloody scene, gunshot wounds, and so on.
And so whenever, say, without naming any exact people for anonymity and privacy, I messed that word up, and privacy, say if you have done investigations in the past, and whether that was, say, a murder or a car accident or things like that, can you walk me through kind of your frame of mind when you first come on scene to one of those that you just have in mind? Kind of like the checklist of, okay, I'm looking for this, or things you do. Do you touch the body? Do you move it or keep it in the same position? How does that work?
Right. So the law requires, when there will be a scene, a crime scene, the law enforcement, usually they will secure the crime scene, and they will do the preliminary investigation to see how many victims, any, say, bullet or casings, and other weapons, any potential other evidence they will collect. Usually they will not touch the bodies until we are there. So we do the investigation of the victims, the body, to see, preliminarily how many gunshot wounds, if seen, or how many stab wounds, or, roughly. And then they go to the other scenes like motor vehicle collisions, and when the cars are burned, caught on fire, or when they go to the scene of the drowning, for example, whether the body was in the water, near the water, on the bank, and so on. So that these pieces are very important. And another piece of information is when they go to the scene, say a person died in the bathtub, we needed to know whether the bathtub is filled with water or no water, because it will make difference whether it's drowning or not drowning. And a lot of times these are the critical pieces of information.
And you being there, or an investigator being there, you know specifically what you need to look for that a detective might not know to annotate.
Exactly. So that's our job. And our job, the investigators, most of the time, they would go to the scene to, first of all, what the nature of the scene, the body. And sometimes the body is decomposed, and sometimes the identification and in question. And also we needed to know the medical history, whether this is a natural death or other death. So
that just reminded me, I can't remember if it's here in Tennessee or if it's in Kentucky, or there's some university, and they might still be running it, but they have bodies in different environments to study the rate of decay.
Yes, it is in University of Tennessee. They call it body farm.
So I read about this a long time ago. Can you tell me what the body farm is?
So the body farm is set up by a forensic anthropologist, famous doctor there. And they want to see what condition of the body will endure, whether it's exposed on the surface, buried, with the time, what is the postmortem changes, how long, depends, how long it will decay, how long will go through the process. So they documented it, recorded it, and studied it.
And that data probably gives people like yourself a good idea to fill in missing pieces of death investigations.
Yes, roughly.
Interesting. So whenever you do the investigation, then are you or your team responsible for then transporting the body to the morgue?
It depends on the jurisdiction. We, in the state of Tennessee, there are 5 regional forensic centers. One is in Johnson City, very northeast. One is in Knoxville. One is in Chattanooga. one in Middle Tennessee, and one in West Memphis. So we covered, out of 95 counties in the state of Tennessee, we covered a little over 60 counties.
Oh, wow.
So we have 13 forensic pathologists in our office. And prospectively speaking, in the entire country, there are less than 800 board-certified practicing forensic pathologists in the entire country.
That is a lot. Some counties or districts only have one pathologist.
Right. So we are fortunate enough and to have fully staffed in our office. And Nashville is a place people want to live and want to work here.
A lot of people die in Nashville too.
Yeah, when population grows, yes.
So they say if they transport it back to your office and they deem that an autopsy is necessary. And so before we get there, so autopsies are necessary if there's a suspected homicide, accident, or an unnatural or unknown cause of death?
Right. There's a guideline set up by the National Association of Medical Examiners. We call the NAME. There's a guideline. So what type of cases we need to do autopsy, and what cases we can do examination on the body surface only, and what cases we can do by reviewing the medical history or medical records. So the cases we want to do autopsy on are almost always homicide cases, few exceptions, and suicides, motor vehicle collision if died at the scene without any diagnosis, drug overdoses found outside, and a few exceptions, and baby death, and especially these young children died without any medical attention.
And so probably aside from where foul play is suspected, can families refuse an autopsy for, say, like a suicide or an overdose?
We do. Some families, they will object to the autopsies based on their religion's objection. But there's a law require postmortem examination, including autopsies. For example, the homicide cases usually will require autopsy to rule out any, to document, to examine, and rule out any other potentials.
And your findings are crucial during the legal proceedings.
Yes.
Right.
And our job is to determine the cause of death, the manner of death. The cause of death is defined as an injury or disease leading to the person's death. For example, gunshot wounds, stab wounds, motor vehicle collision, blunt force injuries, and cancer, heart disease, trauma, or disease. At the manner of death in the state of Tennessee, there are 5 categories. One is called the natural. Natural death as a result of 100% natural disease, heart disease, cancer in a hospital, and or died at home, completely natural disease. Second is called accident. Accidental, as I described, as a result of motor vehicle collision most of the time, drug overdose. And the third category is called homicide. A person is killed by another person, but usually exclude motor vehicle collision because motor vehicle collision usually is killed by another person, another driver. Even under the circumstances of drunken driver, hit and run, in the legal sense, they were guilty. But in our determination as a matter of death is, we classify it as accident. And then... So for homicide, you're not placing guilt. That's just the fact that this person was killed by another human. Right. So homicide is different than murder. Homicide is statistics, vital records. For example, if the person is involved in police shooting, the victim we classified as homicide because this person was killed by a law enforcement. But we classified it as a homicide, but in the judicial sense or in the district attorney's sense, they decide whether to prosecute or not, whether it's justified or not. And we see that so often in the news. Some people will be charged, but majority justified. And that it's like a different. Murder is a judicial term. It's decided by the judicial system. First, the district attorney would file a charge, and the trial at the court or settled out of court.
With motor vehicles, I was just curious. You've probably, how many motor vehicle deaths do you think you've seen in your career?
Oh, hundreds of them.
So out of those, do you feel like most or the deaths are wearing a seatbelt, not wearing a seatbelt?
Both.
So both.
Both.
And then there's so many variables, but what do you is there a commonality of the cause of death? Is it blunt force trauma to the head? Is it bleeding out? What do you
Everywhere. Blunt force trauma to the head, the torso, extremities, sometimes just the extremities, the broken bones, and sometimes bleeding so heavily. And sometimes even the car is caught on fire and the victim is burned during the accident or after the accident.
So speaking of that, I was doing some research, and so you were a part of a case, an officer here in Tennessee was murdered, and he was taken in his police cruiser.
Yes, that was a high-profile case in Dixon County, and that officer was called to examine or investigate a suspicious driver, and he was basically killed by this driver, and he was the sergeant was shot multiple times, and his body was put into his own car, police car, and the perpetrator set him on fire and drive his body to another place and set on fire. So I was involved in the investigation and autopsy of that case.
So did you arrive on scene for that investigation?
No, I have to also to tell you that, we only reported to the scene or responded to scene in 2 counties, Davidson County and Williamson County. The other county, they will do their own investigation, and they decide whether to send the bodies to our office for autopsy to do the further investigation. So most time, if they send a body to us, we'll do the autopsy automatically for them. And that one was investigated by Dixon County.
And so without respect to the families, without going into too much detail, when there's multiple causes like that, where you have burn injuries and gunshot wounds, is that a very comprehensive autopsy to try and figure out all of that, all of those pieces?
Yes, it was a very complicated case, and he suffered multiple gunshot wounds, and he suffered also the thermal injuries, basically burn to the body. And eventually the cause of death is determined, the manner of death is determined in the trial. I was involved, and I went to testify in the court as an expert witness. By the way, this is part of our job too. We will go to the trial from time to time and as an expert witness.
You're a double expert. You're the doctor and the lawyer.
Yeah, sometimes, yeah.
So in that case, did you determine that the thermal injuries and the fire that happened after he was deceased?
Most likely, he was already passed, and after suffering multiple gunshot wounds.
Whenever you work on cases like this, whether it's young men, police officers, women, children. Do any of these cases bother you? Did they bother you in the beginning, or do you detach, or how do you operate through that?
Right. So a lot of cases are very emotionally involved, and we have to learn to cope. And in our office, there's called a wellness program. A lot of doctors and the investigators and the technicians were in that field, and a lot of times they work together to see how they will, cope with the situations like that.
So were you ever personally bothered in the beginning, or did you have a really clinical mind where you could shut that part off and go to work?
We have to try to cope with that, and you cannot have the emotion occupied your mind.
Mm. Do you feel like those cases ever stay with you afterwards? Do you ever think about them, or?
Oh yeah, all the time. And when you mentioned that case, I already, immediately realized the case was still in my mind.
And does that bother you at all, or?
Yes, actually, you deal with the situation, you own the situation, you have the ownership of the situation, and a lot of times you have to cope and deal with the situation.
So with you see mortality. You're faced with your own mortality every day at work. How do you feel about that?
Right. So we basically are involved in a death investigation. We see dead body every day, and we have a different perspective for the life and for the living and the families and the friends and the community and the society in general.
Hmm. And so do you think about your own mortality, or do you have to have a sense of humor when you come into work to be able to not take everything so serious?
Yes, and we all, work as a team. Mm-hmm. Obviously, we have doctors, we have investigators, we have technicians, we have supporting staff members, and we all work together as a team because that's important, because you cannot do the job by yourself. You have to work with coworkers, and as the work environment is very important to us, we have to keep that healthy, welcoming, and friendly. Otherwise, you will be in trouble. Yeah.
I know yesterday I was prepping for this episode, and I was watching videos explaining working at medical examiner's office and walking through autopsies and the morgue, and videos on how autopsies work. But at the same time, I'm eating my lunch. And so I'm eating pulled pork barbecue, watching videos of the autopsy in the morgue. And my girlfriend walks in and she's like, "What are you doing?" But I imagine after a while, it becomes a normal office.
Yes. And friends of ours will usually question, after you do the autopsy, how can you eat? How can you eat a barbecue meat and stuff? But we see that, the dead bodies, almost, myself, our office, we do that 365 days, except one day, we'll close the office for the Christmas day. And every day else, we do autopsies. And
so there's someone on staff 24/7.
We have staff on call 24/7, and the doctors on call 24/7, and we will respond to see if necessary. But that's like a 24/7 operation.
And so going back, say we have a complicated case where there might be other injuries, and say whether it's a vehicle, a murder, now there's also burn injuries, there's a lot going on. Can you walk me through the beginning? So they bring the body in and you prep it. What are the steps? How do you start going about doing an autopsy?
Right. So the autopsy is a procedure or procedures. So first of all, when the body is transported to our office, we will do the process. take off the clothing and photograph before taking off, photograph as is and photograph afterwards, and the different angles to see any trauma, any specific characteristics like tattoos, scars, gunshot wounds, stab wounds, all the things you have to document by the photograph, and process the fingerprints, and then withdraw the blood and eye fluid if necessary.
And that's all for testing?
For postmortem toxicology studies to see if there's any drugs or medications on board. Mm-hmm. And after that, we will start the external examination by a forensic pathologist to document and to record, examine anything on the body surface, or, the front, the back, from top to the bottom, head to the toe.
And so with that process, if they're on their back, you do the initial observation. Are you just log rolling them to each side to check?
Yes.
Back?
Yes. So we examine the anterior, basically front and the back of the victim, mm-hmm. and then document whatever you find and, record in your body diagram, we call it, and then open the cavities, including the chest cavity, abdominal cavity, and then the head, to examine all the organs, heart, lungs, liver, kidneys, and spleen, and the brain, to document, to examine and document all the trauma, all the disease, and then most natural disease is caused by the cardiovascular system disease.
So do you find that natural disease, most people are dying from cardiovascular issues?
Most of the time. It's statistically, the heart and the cardiovascular disease is the number one cause, and then cancer, and then other diseases.
And so with that order, do you always start in that order, the chest cavity, the abdomen, and then the brain?
Yes. And after that, we will send the blood and the eye fluids to a toxicology lab, mm-hmm. and then do the postmortem toxicology studies to see is any drugs on board. And then we will interpret the results.
And so I had a brief period in the medical field, and we had someone that came into the ED with a stab wound, and we did a clamshell thoracotomy in the ED with the rib spreaders in each side, and we opened him up. Whenever you do an autopsy, is it done in that manner, or do you go through the middle and through the breastplate?
We do autopsy a different style. We usually call it Y incision, Y-shaped incision, from both the shoulders and then to the middle line. It's called a Y.
Okay, so from each collarbone?
Each collarbone, and then to the bottom of the abdomen, to cut off the chest plate, the rib cage, remove the rib cage, and then to examine the internal organs.
Interesting. And so in that process, you have to cut and remove the chest plate, and
yes.
that gives good access to everything here.
Right. We are different than the surgery because, when you do the surgery, you have to be very careful.
You have to put it back.
You have to not only put back, you have to be careful with, bleeding, with, the vessels and nerves and stuff. But we would just remove the chest plate and to examine the internal organs.
And so in, say, a case where you're not exactly sure, there's a lot going on, you do the Y incision, you open the chest cavity. Do you have an operating procedure? You move heart, lungs, things like that?
Yes. Although, it's not in a specific sequence. Mm. And they have, they are going to remove all the internal organs, and then we'll examine and document what we find during the examination.
And so in those exams, are they, I guess, say the lungs, they cut the lungs to remove them, then they weigh them, and then they inspect them?
Right. Not they, the pathologist.
Pathologist.
And they weigh, we wait, and the pathologist will examine and document the findings of individual organ or organs.
And so this is what I've always wondered. How do they put them back? Do they just put them back in there?
Right? No, we don't put back in the same place. We'll put it back in after we examine. Put back in in a bag, and then put it back into the body, and the funeral home will do their job by embalming, by other procedures.
Interesting. And so that's something I haven't thought about. So there's the autopsy, and the organs that were inspected, they're bagged, placed back into the cavities.
Yes.
Sent to the funeral home.
Yes.
This might be a question for the funeral home, but do they then drain and then embalm each body part, organ probably, and put them back in? Or
no, they will do as a group, as a whole bag, they will put in the embalming fluid, and of course, the body, they will do the embalm procedure.
Interesting.
And by the way, after autopsy, we will not disfigure the face. And the face, the body can still be viewable unless the trauma happened to the face. There's nothing we can do about it. For example, if somebody is shot through the eye or eyes, nose, mouth, blunt force injury to the head, it's unavoidable because
it's a very surgical, precise procedure.
Yes, we will cut, and very careful, very sensitive to where we examine, and eventually the body is still be viewable during the open cascade, during the funeral, during the visit.
So I'm really curious about these in the medical terms. So whenever you're inspecting the brain, how do you go about removing that? Are you cutting through the back portion of the skull to access it? Or do you completely circle around?
It's like around year to year, from this year to the other year. So then we remove reflect the scalp, and then remove the skull, open the skull, and then remove the brain.
And so if you're cutting from ear to ear, from behind...
Not behind, it's like on the top.
Oh, so all the way around from ear to ear.
The top part, little back, but without interfering the figure. Will not disfigure the face.
Right. And so is there an incision to cut across in the forehead? Or
no.
It's behind.
It's always behind. You cannot view, because otherwise, you cannot view as an open cascade.
And so with my understanding, so the brain is attached to the spinal cord.
Yes.
So how do you go about, once you have access through the skull, to remove that?
When you open the head by removing this part of the skull, the bone, the brain will be exposed, and then you can remove the whole brain for examination.
And so whenever you remove it, do you pull the brain out?
Yes. Take the whole brain out, just like any other organs. We do the examination thoroughly to see if there's any trauma, disease. Most of the time, you'll see, say, stroke, infarction, bleeding, and trauma.
This is a question reminds me. When people have, say, strokes out of nowhere, they don't have a medical history, things like that, can that autopsy show things like strokes or aneurysms or things like that?
Depends on how fresh or how time passed. If it is old stroke, it will be easily found because the brain will have unique changes after the stroke. Stroke has two major types. One is called ischemic, one is bleeding or hemorrhagic. If it is hemorrhagic, it will be easily found, and a lot of blood or necrosis. Ischemic is the same thing if it is necrotic tissues.
So in patients that have had, say, multiple smaller strokes over a period of life, does that show up in brain tissue as bruising or?
Depends on the what do you call the extensiveness. As if it's very isolated, very small, sometimes it's hard to see. But, it depends on, the history and how big or how wide the stroke is.
I see. And so with the brain, I guess from the surgical standpoint of it, because the brain is connected to the spinal cord?
Yes.
And so whenever you have access to the brain and you start to pull and remove, do you have to then make an incision to cut it from the spinal cord? Or does it all come out together?
No, spinal cord usually will not be examined. Only in few cases, if there is any specific reason to remove the spinal cord, because it's very hard to remove the whole spinal cord. You have to cut open the vertebral column, and usually we would just examine the brain and the brain stem. And
so that's just an incision or a cut to be able to access the entire brain and the brain stem?
Only brain and brain stem to see if there's any trauma, again, bleeding, necrosis, tumor sometimes.
Interesting. It's almost time for lunch.
Yeah, will not affect us,
So after you inspect the cavities, you place everything back, and then you kind of report everything, and then you have come to a conclusion by that time of the cause of death?
Right. Most of the time, not most of the time, it will depend on the findings. If it is so clear, for example, the heart, the major coronary arteries is completely occluded, or acute thrombosis completely occluded, and heart shows the acute myocardial infarction, or you have a lot of bleeding in the brain. For example, ruptured barrier aneurysm and bleeding all over the brain. Then most of the time, it depends on the age of the patient, and if there's any drug abuse history, we can sign or determine the cause of death at the time. Right then, right there. But exceptions always happen. I had a few cases, like 70 years old, with what do you call the cardiac tamponade, blood accumulated in the pericardial sac because of the ruptured aortic dissection, and the blood accumulated in the pericardial sac. It's like a clear cause of death as a result of aortic dissection, as a result of hypertensive cardiovascular disease. And I think it is a clear cause of death. I thought it was a clear cause of death, and signed out as a result of natural disease.
And his wife killed him.
It's a woman, actually.
Oh, okay.
And then 70 years old, a woman, and I thought it was clear. But then toxicology results came back. Methamphetamine. So this is a stimulant. Methamphetamine will cause blood pressure surge and cause the aortic dissection, maybe associated with that. So I have to amend the death certificate from natural to, say, accident. So that happens several times.
Wow.
So now I will wait and see if there's any drugs in the system before I finalize it, before I sign out the death certificate.
And did the scene where they found this 70-year-old woman, did it indicate or give you any idea that there might have been drugs involved?
No. By the age, by the death scene, there's no indication that the person used the drug.
Wow. Are there other cases that stand out to you like that had a twist or something that you weren't expecting?
Yeah, actually, one case came to my mind is a young guy from another state. I don't want to name the state. So this guy was at a home, had sex with the woman, and died suddenly. And no autopsy was done.
During the act?
Yeah, during the act. and died. And no autopsy was performed. He was buried. And the family of the died person always accused the woman did something to him, and for many years. And the family, petitioned the judge to exhume the body from under the ground.
Mm-hmm.
After 5 years, buried, the case was sent to me.
Great.
It's an exhumation autopsy. The smell, I don't want to say the smells, but that was an autopsy I performed.
So
5 years after he passed away under the ground.
So I don't want to interrupt, but so 5 years. So presuming he was embalmed?
Yes.
So what, I've always wondered this with my loved ones that have passed. 5 years after being buried and embalmed traditionally, what state is the body in?
Right. So I will lead it to that. But it was a very good question. So after 5 years, and his body was transported from another state to us, I did an autopsy, and the body was surprisingly well preserved. And I was able to examine the body, open the head, and examine the internal organs, chest organs, abdominal organs, and the head. After we removed the head, the brain, after we opened the head, removed the brain is surprisingly intact, just like the person died, say, last week.
Really?
Intact completely. And I could examine the brain and be able to see there was diffuse subarachnoid hemorrhage. That was the diffuse subarachnoid hemorrhage all over the brain as a result of ruptured berry aneurysm. The small vessel berry aneurysm ruptured during the sex.
Oh, man. So it was natural causes.
So I was able to, put the question out of, the woman killed that person.
Wow.
Or did something to him as a result of that. And that, to answer your question, there are majorly 3 factors affected the outcome of the postmortem changes. First factor is the embalm. How good is embalm? If there's a professionally done, very well done, that body will last for a long time. Mm. Second is the quality of the cascade. Cascade makes difference. Mm. And, I had a joke told by one of my mentors in the past. Funeral homes always ask you how much you love your, loved ones. Mm. He passed away. Here it is. This is $500 cascade. This is a $100,000 cascade. Depends on how much you love. So they wanted you to buy the most expensive ones. Mm. But as a result, the high quality of cascade will make a difference. Mm. So the third factor is the environment, where the body was buried, cascade was set. If it is a frequently flooded, very moist, mm-hmm. it will destroy the body quicker.
So there's a big difference between people buried in Louisiana to Arizona.
Yes, not necessarily in the individual states, but individual area.
Yeah.
If it is like a flooded area versus very dry underground, and it will last for a long, long time. So I had a case with like a 30-some years old, exhumed. We can still see the gunshot wound to the skin.
How long had he been buried?
30 years. 30 years.
He'd been buried for 30 years?
Yes. Yeah. Almost 30 years. We still able to see the gunshot wound on the skin.
So what were the details of this? What caused the exhumation?
Again, that's the question of any foul play involved, and they wanted,
After 30 years?
Yeah.
So new evidence might have come up, something that...
Yeah. So that's like a very extreme. In 5 years, I had 10 years and, sometimes.
So what was the differences between the 5-year body and then the 30-year?
So that 30 years had more decay or postmortem changes, like insect activities, the bacterial and other changes, and less preserved or less well preserved.
Now, at 30 years, say, and each scenario is unique, but were the clothes still intact?
Yes, a lot of clothes is still intact. And
it's more of the surface skin that's starting to...
No, actually, the skin is very resistant to the postmortem changes. The internal organs, usually they will decompose or autolyze quicker. The skin is usually lasted for a long time. Obviously, bones last usually for a long time. Depends on the condition.
So on the 30-year case, what items started to decompose? The organs mainly, or was it other things?
No, organs are all gone, but the skin, the important thing is we want to see the skin with the gunshot wounds. What type of the gunshot wound?
So in that case, you exhume the body. What did they want you to specifically investigate?
So there's several things you can see in terms of the gunshot wound. First of all, how close or how far away. Usually we'll say 3 ranges called the close range, intermediate range, and the distant range. If it is distant range, usually people don't kill self with this, let's say, long distance.
You're not going to do it out here.
Right. So if it is close range, it's hard to say it is suicide or homicide, but it depends on the other factors. If it is far away shot, usually you can rule out the suicide. So people will say whether it's suicide, homicide, based on the gunshot wounds. And second, if you have organs still there, what organs or structures damaged. And the third, to recover the projectile, if it's still inside the body, to be compared with the specific weapon. And they call the, forensic ballistic or in the crime lab to compare the bullet with the specific weapon, the marks on the bullet will be examined under the microscope. And that rifling is very unique to the specific weapon. It's like a fingerprints.
So when he was buried 30 years ago, was there an initial autopsy done or no autopsy?
The particular case, I forget. Yeah.
Interesting. 30 years.
Yeah.
And that's the oldest?
No, that's like what I know, personally involved.
Wow.
But oldest, I'm sure there are more cases.
So have you had any cases where, say, the scene or the initial investigation ruled it, say, a suicide, but then after your investigation, you found out it was a homicide?
Yes, we have a few cases like that. But I will not go into the detail. Sometimes some people will say, okay, this case is so unique, people would notice.
They would know.
Yeah.
Interesting. So that brings me, I wanted to ask you about it. So Jefferey Epstein, it's been, I think, about 5 years now. There's a lot of controversy. It was all over the news. There were medical examiners from New York, and then I think a medical examiner hired from the family who also was involved in, I think, George Floyd, a couple other secondary autopsies. So there's a big debate on the initial report saying that it was a suicide, the secondary autopsy saying it was due to breaks, I think 3 breaks in the neck. It was a homicide. What's your take on that?
So first of all, as a medical examiner, or in our jurisdiction, we are independent. We don't work for the government or work for other side of there are always a few sides, but we work for the decedent. And sometimes it impact their family. So we are independent. We are not influenced by outside pressures. And we don't want to be involved in the political scenario. And I'm sure the New York Medical Examiner's Office will act the same. So they are independent, and we have to trust their independent findings because, as I said, they don't have a fight in this case or the outcome because they want to make sure that the autopsy will tell tell the story and the decisions, cause of death, manner of death, and it's not in the political field.
Right.
And I would tell you also, suicide versus homicide sometimes are difficult, but most of the time they will not so difficult. Depends on, if it is suicide, you will have to have some history. For example, depression, for example, suicide attempts, suicide ideations, and then
some type of motive.
Sometimes, most of the time, yeah. And then some people just suddenly want to kill themselves. There's some, that always have some exceptions. And then we do the investigation, surveillance, and if in terms of the cell, anybody goes in and out, and potential, foul play. And from what I gathered from the news, the surveillance is somehow not working or something. But that aside, autopsy will show that this ligature marks, and if there's any, what do you call it, defense wounds, usually people are not sitting there to be strangled without a fighting.
Even if they're, say, asleep,
right,
and then someone starts strangling them, they'll instinctively reach for.
Exactly. Will struggle, will defend themselves, and usually you will see some marks around the ligature mark. If it's strangled by a ligature or strangled by the hand or called the manual strangulation, you will see some marks around the area. And then do the toxicology. So based on a lot of investigation, autopsy, lab studies, and this information they gather, they will reach a conclusion as the cause of death and manner of death. And the other thing is, the first autopsy has the most evidence preserved.
Because it's untouched.
Untouched, and you did the first autopsy, you have all the, the body, you have all the parts, you have all the markings. And the second and third autopsy, a lot of times they don't have the optimal conditions. And the other thing is, whether it's hide bone or some bones in the neck, broken or not, it happens to suicide, hanging, or homicide strangulation. So it's not a clear cut, say, if there's a bone fracture or that's a homicide. It's not that simple.
And I think that, from my understanding, that was the big argument point from the secondary, was that because there were 3 breaks in that bone, that he had never seen a suicide where all 3 of those bones were broken in the neck.
Right. So,
but it could be.
Could be. Yes. And also we have to question whether the bone was fractured due to the autopsy procedure or it's antemortem or perimortem.
And if they broke things like that, say in the initial autopsy to access certain areas, would they annotate that, or could things get broken by accident in shifting parts of the body?
They will always record and described in the autopsy report whether this small bone was fractured, because this is crucial also to the investigation, to the autopsy. As a forensic pathologist, we always examine that small piece of bone called the hiatal bone, and that's in the neck, and just to document whether it's already broken or not.
And I was interested in this and just researching history. So when there were executions by hangings, whether going back to France or America or different parts of the world, they had to calculate certain rates so that the drop would be long enough to cause the fracture but not decapitate the head based on gravity?
Yes.
Because strangulation would take longer instead of a break?
Not necessarily. By hanging, the mechanism is same, but whether hanging or strangulation, basically they occlude the vessels, and if the force is heavy enough or strong enough, will occlude the trachea or windpipe. So literature shows that only 4 pounds of a force is necessary to block the vein. About 10 pounds of force to block the artery, the carotid artery. About 20 pounds will be necessary to completely block the airways. So it would be easy or difficult. It depends on what perspective to, hang self or to struggle somebody. But it depends on the situation. It depends on the fight. It depends on the struggle.
And so with that case, and with Jeffrey Epstein, I've looked into it a little bit. You brought up something before we started about if someone was, say, the argument of it was killed and strangled with the marks around the neck, there would have been the secondary, say maybe fingernails or something to try and stop it from happening.
Yes.
And so there could only be a few scenarios, whether he hung himself or he let someone strangle him without resistance, which doesn't seem likely.
Right. People in his height or his weight or in his situation, it's not easily strangled without any fight.
And even if, say, you went into it with the mindset of, I'm going to let you strangle me, do it, the panic would probably set in and he would try to fight back.
It's a basic instinct.
Yeah.
Yeah.
Interesting. Before we move up past that topic, do you have any specific, say, autopsies or investigations that really stood out to you, that stick with you, that you think about?
The case we discussed about this sergeant killed in the Dixon County. And another case stood out a little bit. About 20 years ago, this truck driver, long-distance truck driver, I think it's along the I-65 from north to south or something. And reportedly, he will do something in a bus stop and then killed a victim along the way. And then we had a case here. I was involved and did an autopsy, and this woman was shot close range and did autopsy. And then our detective in this metropolitan Nashville, specifically Detective Pathologist Dr, and he was a lead detective and did such a good job, and eventually solved the serial killer. And that, my job or our job is a small part of that big investigation.
Wow. And are there patients that affect you more than others, whether that's age, gender, or children, or things like that, or?
Yeah, the most difficult cases involving the children because they are defenseless, and a lot of times they were killed by, some people, whether by the relatives or sometimes killed by daycare and a caregiver.
Yeah.
And we have that in the cases, we were involved to do the autopsies and determine the cause of death and manner of death. And these children, very young, defenseless, and is senselessly killed by another person.
Do you find in your experience that most of the time they're killed by someone they know, or they're a caregiver? Or?
Most of the time, it's not random for the children usually.
What is the youngest autopsy you've had to perform?
Youngest, it's a fetus. So it's like not even completely. So the fetal demise will do sometimes autopsy, usually big enough, and after 20 weeks gestational age, and we will do that also. And the youngest, 1 month, 2 months, few days, you name it.
And so for fetus, in those scenarios, are you investigating that because the family wants to know, or because there might be foul play involved, or?
Right, it depends. The most common scenario is the mother was on drug, say cocaine, and it caused the fetus death, and then we delivered, and usually depends on the situation, delivered at home, delivered at hospital, we will be involved in the determinate cause of death, mental death. Mental death usually is not a question on these cases because they were not born alive. So there's no mental death, but cause of death or as most reasonable cause of death as a result of, or sometimes just say intrauterine fetal demise as a cause of death.
Man, when it comes to that, a lot of people I talk to, whether military, first responders, they have a handful of memories or events or cases that have stuck with them. Do you have any of those when it came to kids that you think about periodically?
One case, I remember that suffered so many injuries in a different stage of healing. Basically, I don't want to get into the very detail who did it, whatever. He suffered multiple injuries, bone fractures, head trauma, a lot of scars. And that's classified as called a battered child syndrome. Basically, the child was abused and traumatized by the caregiver in a prolonged period of time. It's not like one episode. It's like abuse for a long period of time. So these are very hard.
That was probably younger than 12 or so, or a teenager?
No, not even 12 years. That's within a year or 2 years. Very young.
Oh my gosh.
Yeah.
And so throughout, I know we've talked about it, but throughout, I guess, going about your day or relationship, are you married?
Yes.
Do you talk with your wife about these cases?
Usually not, because, people say, I don't want to hear it, that type of thing. So I don't want to get into specific details. And generally speaking, that was on the news. Yeah, I did autopsy. Maybe that. It's more like it.
So what mentality, what personality do you think it takes to do your job? Because your job is very intense.
Right. So I told, whoever is interested in this field, I tell them, you have to have passion. You have to have specific, I don't want to say strong guts, and you have to have the interest in the field. It's not like, I cannot make made it in another field, I want to come to you. It's not that easy. You have to be,
really called to the field.
Yeah, called to the field. You have to have a passion, and you have, have that really interest in the field, and care for the people, care for the family, care for the dead person, and care for the community in general.
Did you, over your career, anything you've done or seen, did you ever get nightmares or anything from that?
Fortunately, I don't have that.
Oh, nice.
Yeah.
Whenever you're working, say if it's alone or if you have a call at night, does it ever get eerie working in the morgue?
No. Actually, as I said, you have to have passion.
You're right. Your brain's wired differently.
Yeah, you cannot just say, okay, I drive to my work. Yeah, that type of thing, it will not work out.
Have you encountered people you've worked with that have dipped their toe in and it just was not a good fit?
Over the years, we have maybe one or two. Yeah, but majority, they said, and a few people were determined to become a forensic pathologist when they were like second grade. They will say, I will always want to be a forensic pathologist or medical examiner.
How long have you lived in Nashville?
25 years.
And how long have you worked with the medical examiner's office?
Actually, this is my job and the only job and first job.
Really?
Yeah. I, finished my training in Philadelphia and moved to Nashville. That's my only job and my first job and only job.
Wow. And as the chief medical examiner, are you the head of the department for that area?
Yes. I oversee the operation of the entire office.
So have you ever done an autopsy or had an autopsy come through where you knew the victim?
Actually, that's like a really good question. Over the years, I've been here like 25 years, and we had multiple occasions. We had to do autopsies on the persons we work with, our colleagues, and some families, members of our coworkers, and they are particularly hard and not very easy to deal with.
So have you had to do any autopsies of people that you've worked with?
Personally, I have not, but our office has done many cases.
Yeah. Any family or anything that you've done or been a part of had come through the office for you?
I have my
families in.
Yeah, my family has only like 3 or 4 people in the country. My wife, my son, and his family. That's all. And my son lives in Philadelphia.
Whenever those cases came through where they were colleagues or family, what was that like? What was the environment in the office that day?
Yeah, that's very sad to start with. And then we will obviously try to avoid anybody know the persons, and we'll ask somebody else who did not know the person or the victim, and we wanted that person to do the autopsy. And personally, also, I forget to mention that I have performed autopsy on several people I knew outside of my office, not necessarily very well, but I knew of them.
What is that like? Because we've all been to funerals that we have someone that we knew, but to do an autopsy on someone that you know.
Right. It is, again, it's hard, and you have to be prepared for that. And, I want to try to, at least to avoid somebody knew the person to do the autopsy.
As we're wrapping up, I had a few questions. Have you heard about people who have cryogenically frozen themselves?
I heard about it in the news, they will, the whole body or part of the body try to revive, or somehow in the future, the technology comes up and they resurrect.
Based on your understanding of pathology, at least right now,
right?
Because I'm not exactly sure what they're doing, but I'm assuming they're using chemicals so the crystals don't form in the brain or the blood. But is there any realm of possibility, I know this might not be your specialty, but where someone could cryogenically be frozen and then eventually be reanimated?
Right. So although I'm not in this, what do you call in a specialty, but based on my physiology degree, I have a PhD in physiology. When you die, the body just die with you. No matter what you do, no matter how developed in the future, no matter how advanced technology in the future,
it's gone.
There is no way you will bring back anything in that scenario. There's no way.
And the essence that makes us, the consciousness, is just detached from the tissue.
Right. It's not only detached. The whole thing is, the body works together. So that's why any organ, any tissue is important as a whole. It's not like, say, you have the brain, you have the heart. No, your body works as a whole, together. Any part of the body, no matter how small, it can kill you.
Right.
Even say thyroid, small thing, or adrenal, small thing, they can still kill you. And in the situation when the person died, there's no possibility, zero possibility the person will come back, no matter how advanced technology in the future.
So with that, what do you think? Are you religious at all?
No.
Or, I didn't think so. So for people's interpretation of consciousness and a soul, you're very intimate with death. You work with that every day. What do you think that is? The consciousness, the soul, what makes us different? What is that?
So the consciousness is basically defined. You are aware yourself and your surrounding. If you don't have that sense, you lose consciousness. So if you are not aware of the surroundings, deep mind, and you lost consciousness, whether by disease,
like Alzheimer's or dementia.
No, that's different. By disease or trauma, for example.
You mean losing consciousness?
Losing consciousness, and then you basically lose consciousness. If it's say loss of blood supply to your brain. Within a few seconds, maybe 20 seconds, you lose consciousness. And if your brain loses blood or oxygen supply for a few minutes, the brain will not come back. The brain will suffer what we call the irreversible trauma or damage. So the body will either be vegetable state or dead, depends on how far gone.
So do you think there's a soul in humans, or? So
that's like
it's in theology. We're stepping in there.
Yeah, people would say soul, you know, always there, and resurrect, always there. But
in your personal, not professional opinion,
right? I don't know. So that would be the easier answer.
Did you, whenever you got into the medical field, were you into theology at all, or do you feel like your experiences in this profession changed your view on life and death and the afterlife?
Exactly. Different perspective, as I said. You see, experience, your work, your daily work, and see the cases and victims and patients. They die, they pass away, no matter what, happened to them. So you have different perspective. You try to avoid the mistakes they made and try to avoid the mistakes.
So you have a whole book of what not to do to not die.
Exactly. A whole books of, experience. I've personally did more than 5,000 autopsies in my career.
5,000, more than 5,000.
We're about 5,000 because I was asked so many times, how many autopsies have you done? I don't want to say exact numbers, but I don't keep the exact numbers.
Yeah.
But way above 5,000.
So with that many autopsies, when you look at people throughout the day, are you wondering how you would do an autopsy to them? Are you thinking about that with me?
No. I don't keep that in my mind, but I would say how to avoid this person's death. You know, for example, easy example. People don't consider themselves when they get old. They will go to the roof to repair the roof and falling down from the roof. That's completely unnecessary because a lot of times you don't know how much you are not there if you take the risk. Another example, people try to cut a branch on the ladder. The branch fell on him, hit him, died.
Man.
So something like that, people can avoid easily.
So have you had any cases that you've done autopsies on where the cause of death was related to seizures?
So seizure is very complicated. And it's what do you call symptom. It's not necessarily a disease. Maybe a disease like epilepsy or some other, A seizure itself is a manifestation of some disease underlying. If you have, say, trauma to your brain and other, disease, most of the time is trauma, and then leave some symptoms. That's seizure. And people will use medications to combat with that, to deal with the seizure. Seizure itself is not necessarily a disease, usually a manifestation of other underlying problems.
Have you seen anyone that's died from the seizure?
All the time, yes.
Really?
Yes. Because, seizure, say, a lot of times the terminal event is seizure. And the witness said, I saw that he had seizing activities. And, whether it's due to the heart disease, whether it's due to diabetes, whether due to other disease. The terminal event, a lot of witnesses or people see that.
And the way they could die from a seizure, if it's uncontrolled and it cuts off blood supply to the brain or oxygen to the brain?
So that's another thing. Seizure itself usually is not the cause. The other things manifested as seizure activities. And the seizure itself, say epilepsy, and most of the time when they had that disease and they fell, they hit something, as a result of that. So seizure has a lot of different manifestations. Sometimes it's like very brief. You just stare at something without knowing it. And sometimes it's a full-blown.
Like a grand mal.
Yeah, grand mal, like completely seizing activities, like completely stretched or become very rigid. So different manifestations.
But it's interesting how you can just lose consciousness.
Exactly.
And you're just gone.
Right. So the brain is very sensitive to the oxygen to the blood. And the signals, as I said, a few seconds will make difference. And most time, the danger is you fall, you hit the ground, you suffer trauma.
Interesting.
So yeah, usually you'll see a doctor. Doctor will prescribe some medications.
It's amazing the medication.
Medications are so advanced, they can prevent, a lot of seizure.
Are you afraid of your own mortality, of your own death?
Oh yeah, it's, everybody is afraid of the death. No exception. But you have different perspective.
What's your perspective on it?
You see, exactly. As I said, people will die. Will, everybody will die. And you try to delay the death as long as possible. If you cannot be independent, sometimes it's hard to live. And again, the other thing is try to avoid the things will cause you danger to risk your life.
For people, say we're in Tennessee,
Right.
As we're wrapping up, if you could give advice to people, say that the population you've seen in Tennessee, whether that's diet, obviously don't do a lot of these drugs, what advice would you give based on all of the death you've seen come through your doors?
So the advice can give is like any other physician.
Yep.
Whether you listen to or not, it's different. So very, very easy things to avoid or to try to practice. Don't smoke. Drink moderation. Don't overdrink. Don't use drugs. Change your lifestyle, whether by a healthy diet, by exercising. Although, it's hard, to say exercising. Myself, I don't like exercising. But, these are the things, try to, lifestyle changes and will make a difference. And also try to avoid, the dangerous stuff.
Yeah.
Speeding, drunk drive and reckless drive, race, in the fields or something,
Do you see a lot of, as we're ending, I'm thinking of all these questions, coming through your office, so Nashville is a very metropolitan area. Do you see a lot of either gang violence or shooting, deaths, things like that come through? Like, I guess what I'm trying to get is, for Nashville specific, this surrounding area, other than, say, disease-related death, what do you think right now the trend of deaths that come through your office are? Is it shootings, car wrecks? What's the majority?
It's not, again, the statistics, the most common is accidental death, whether it's by drug abuse, whether by motor vehicle, whether by, say, falling or, by the other trauma. That's the most common in terms of the mental death, how people die. And then next one, it will be natural disease, heart disease and other diseases. Sometimes it's, I would say, relatively easy to avoid, by not smoking, by drinking responsible and exercise and a diet.
Yeah.
That type of thing. In terms of the gang or the crime, it will be very hard. It will be like a police and law enforcement job, and they would have the statistics.
And that's in their realm of...
Right. They will have the statistics, is whether this is gang-related or organized crime or,
So another question just popped up, and it might seem ridiculous, but... So I go down a lot of history and government history as well, and things with, say, aircraft, alien reports, things like that. And there are reports from the 50s, the 60s, up into the 70s timeframe that there were extraterrestrial bodies that were recovered in reports.
Area 52 or something.
Some of those areas, and that there were bodies recovered and that autopsies were done on these. Do you think there are, this is the alien question, but do you think there's anything else?
I believe there is any extra, torrential, what do you call it, ET exist. But
you do think they exist?
Yeah, definitely. There's no doubt about it, because the universe is so big, so many planets, so many places.
I can't believe we waited till this long to get into aliens.
I know, but the thing is, there's no doubt about that. But to encounter an alien from extra space, I am very, very skeptical and not believe that yet.
I see.
Yeah.
And then, so in all of your time doing this, you've had a very long career. Have you seen or experienced anything in this line of work that you couldn't explain?
Oh yeah, we have in terms of how the person died, we have a category called undetermined. Undetermined because based on the investigation, based on the autopsy, based on the lab studies, including toxicology, we cannot come up with how the person died, or more than one possibility how the person died, and we say this is undetermined. An easy example is in the field, we found an intact skeleton remain. And we examined, anthropologists examined, and there's no trauma. And originally, we didn't know the identification. And later we figured out, positively identified the victim of the patient.
Based on the skeletal remains.
Yes. And then there's no history, no trauma. Then what?
Mm-hmm. And all the evidence is gone that could have pointed to something.
Exactly. So that's just like 1%. I mean, no, it's one small percentage of the group of disease, cases, we cannot figure that out. And we have less than 5% of cases, usually 2 to 3%, we cannot come up with how the person died or more than one possibility.
So that reminds me, so with Nashville, there's a lot of Civil War battles happened around here. Has your office been involved in any skeletal reviews or anything of, say, bodies that were exhumed during construction or new builds in the area?
All the time. And
really?
Yeah, because they will say, is it a historic remains or some victims of a homicide? And also, very funny, one time they brought me a foot without a skin. I said, what is this? I look at it.
It's a foot.
It's a foot, but without a skin. And
was it a tissue or just bone?
Just the tissue, bones, and the softer tissue.
So everything but skin.
Right. So eventually we came up, it was a bear foot.
A bear?
Bear foot.
Not a barefoot like my feet are right
I know,
now.
the bear, the animal bear, their foot is just like a human
Really?
foot. Yeah, you can change. I mean, you can check it or Google it, say, without the skin. Obviously, with the skin, it's easy, the hair, it's a thick skin. But without a skin, you can see it, x-rays or something. They are very similar to the human
So
foot.
with the historic remains or victim remains, so you've had cases like that.
Right.
So how can you tell, say, if someone died Civil War era as opposed to a victim?
Sometimes it's easy, sometimes it's difficult, and usually we'll involve these cases with the anthropologist. They are specialized in looking at the bones, examine the bones. They can come up and say this is historic and no foul play or any trauma to that.
And so is that carbon dating the bones, or
it's in theory you can do that, but within a few hundred years, there's no need to do that.
Yeah, I guess that is a while away from now.
Right,
the Civil War.
It's like if it's like tens of thousands of years of bone, maybe you'll do that.
Interesting. So I know we're wrapping up. I've said last question about 4 times. I was reading recently that the Earth is, I think, 4.5 billion years old, roughly.
Yeah.
And humans were first documented around 300,000 years ago.
It varies from a few 100,000 years to a million years. It depends on the studies.
But then consciousness and human history, recorded history, wasn't until maybe 100 or 1,000 or so years ago of recorded human history?
A few thousand years, yes.
And so what I read is that there were humans, but then there was a moment of consciousness where history started getting recorded. From your standpoint of, the human anatomy and things like that, what do you think happened in this 300,000 years of human development when it comes to the brain, awareness, language?
Right. That would be like a developmental or it's called, it's what you call the ancient study. And I am in a group of believing in evolution and Darwin's theory.
Yeah.
And I'm aware that a lot of people has doubt about that. They will question about, how do you know, what the stage and what difference. But from what I understand or studied, the evolution theory is good to explain how different species eventually evolved based on the time and by the evidence.
Interesting. So when you have skeletal remains, and it sounds like there's specific departments to review skeletal remains, but I was prepping for this, I was watching videos of medical examiners, and they were saying that you could tell, obviously gender by the pelvis, but they said that you could tell race by the bone structure of the skull?
Yes, and most of the time.
Can you tell me about that?
So, first of all, whether it's male or female, usually you can tell by as you said, the pelvis, the shape of the pelvis, and also by the bone, how big and what, associated these, projects in the bone itself, because the muscle will pull the bone spike to reflect whether it's a male or female, and and also the shape of the skull. They are different in shape, and also the what you call the orbital, the eyes, the bones are different based on this race, different based on this gender.
Interesting. And so with, say, the skull being able to tell race, do you think that's because for a long time races were consolidated in certain areas of the globe, and then based on that evolution or that environment, it shaped skulls differently for each?
Yes, and it depends on the race and the shape of the mouth, shape of the jaws. They will be different, and it depends on the race and sometimes the gender.
Interesting. There's so much to learn from the dead.
Dead and alive.
The dead and alive, yeah.
Yes.
So as we're wrapping up, you work in Nashville, you oversee the office there. At one time, how many cases could your office handle? Because you take care of Nashville and a few of the surrounding counties.
Right.
So say, how many are you equipped to handle at one time?
One time, it depends on the complexity of the cases, about 10 or ish cases one day, because we have 2 doctors on duty and every day.
So if there is any type of mass casualty event, or say, God forbid, say a war came to America or things like that, if something happened, that's where I guess the cooler and the storage comes into play?
Right. Actually, we're fortunate, and recently we expand our cooler project. So we can store more bodies in our facility. And we have a plan called the mass fatality. In the nationwide level, there is, what we call the National Association of Medical Examiners. And we are fully accredited and by the organization. That's the highest standard in the country. And if we cannot handle, we have other colleagues in the state of Tennessee. And if even more cases, we will have a national response team.
I see. When we were talking earlier about the type of personality or mindset it takes to be in this field, it reminded me of a story. I was doing clinicals at a transplant hospital in Texas, and one of the patients in the ICU, he had passed away from, I think, liver failure. He had jaundice, really bad. And so we removed everything and we bagged him up, and I was taking him to the hospital morgue. And the one of the nurses sent a security guard with me to walk with me. And this gentleman, I could tell, was not comfortable at all. And he was in a white
Body bag.
Mm-hmm. And so I'm pushing him through the hallway, and he takes me to the room, and he opens the door, and I push the hospital bed in. But the room is maybe as wide as this room, and it's just 2 coolers on top, 2 coolers on the bottom to roll into. And so I open it up, and I lift the bed up, and I look at him, and he's as far away in the corner as can be. And I'm like, I'm going to need your help. And he's like, nobody told me I had to help. And I'm like, I need you to help me pull him over. And he was not about it at all. And I tried doing it myself, and I can't remember, but the body made some type of, it might have been gases or some air moving out. But he helped me pull it over, and then we shut it. And before I shut the door, I looked back, and he was already gone.
That's not uncommon. People are afraid of dead bodies.
Yeah. Well, Doctor, I really appreciate you coming on. I really enjoyed this conversation.
Thank you for inviting me. And, our job is also to educate the public, to educate the community, and to teach them what we do, what our responsibilities are, and see the other side of the story, how we, do our jobs.
Before we go, because I agree that's very important. Before we go, is there anything that you think the public, the community, they don't really know that you try to get out, that you want people to know about your profession?
Right. So the general idea is this. We, as a medical examiner, as a forensic pathologist, we do the job independently, and we will be as independent as we can. We don't have any pressure from any government agencies, or sometimes from family. Yes, but we understand. But we do the job very sensitively, and we respect and the dead person, their families, their relatives, and we're very sensitive to the death, and we deal with the sensitive issues for the families, for the community in general, and we will try to do the best as we can to provide the services to the families, to the community, to the people we serve.
Well, I am very grateful that there are people in the community like you, and I really appreciate the work you do. And it shows how much you care for your fellow citizens, the community. You've spent your life doing this, and I appreciate it. And it's a very intense job, and I'm thankful there are people out here like you doing it.
Thank you.
Thank you for coming on, Doctor.
Bye.
Bye, everybody.